Ladies and gentlemen, please join me in welcoming the speakers, Dr. Naushad Forbes, Dr. Karthik Muralidharan, Dr. Nandini Rangaswamy, Dr. Randeep Guleria, and Dr. Shuchin Bajaj. May I request Dr. Forbes to take over the conversation, please?
Good afternoon, everyone, and welcome to this session on building India's human capital. It's a great pleasure to both moderate this session, and it's a particular pleasure given both our key speaker today, Dr. Karthik Muralidharan, and our really distinguished panelists. We will be joined a little later in the session by the Secretary of the Child Welfare Department, who's currently, I'm told, with his minister. So very special and warm welcome to all of you on the dais. Today's topic is of great importance to us all. All of us know that we now have the world's largest population, 1.4 billion plus. We all know that we have a young population, and for at least the next 15 to 20 years, the dependency ratio will move in our favor as a country, in that the proportion of the population that is in the working age will continue to rise for at least the next 15 years or so. And this is a huge potential, as the phrase that's always used, this is a huge potential demographic dividend, but it's a demographic dividend only if we make the best of this young and growing working age population. So how do we provide a population of 1.4 billion with decent quality healthcare? How do we provide a population of 1.4 billion with, my understanding is, the world's largest number of schools by a long way, because as you'll hear, I think, not only do we have a large population, but we also have a very fragmented school system that caters to that very large population. How do we provide our huge population and our huge young population with a decent quality of schooling? And those challenges apply across our federal structure, apply across both union and states playing their role in an effective way, with, at the same time, a very large private system, again of varying quality, from very, very good schools at one end to schools that are much more challenging at the other. So we have this very diverse education system, very diverse health system, diverse in terms of quality, diverse in terms of private and public, diverse in terms of which part of the population they seek to serve. How does this whole wider system deliver? It's a hugely challenging topic. I would argue that if we get it right, we will have a highly secure and prosperous future as a country, because there is no issue that will more decidedly determine our prospects more than the education and health of our population. We're really fortunate to have Karthik Muralidharan with us today. Karthik is one of our leading researchers in, first, the field of education and education quality, what delivers education quality, and he's been doing this for decades. Even, he may not look like it, but he's been doing it for decades. Second, I think he'll mention this, he got from education into other aspects of human capital development, and has been working in those areas too. And he's recently put all of his learning of the last 25 years together in a book. It's called Accelerating India's Development. I have a copy here. And it just won the Crossword Best Book Award 2 days ago. So congratulations, Karthik. And as you know, the book is a forbidding size, but it reads really well. It reads really easily, and it reflects actually lots and lots of not only work on Karthik's part, but a lot of editing on his part to make it a coherent, cohesive, easily reading story. So we're delighted to have you with us, Karthik. Karthik's going to start with a presentation. I won't tease him, but Karthik's going to start with a presentation. He'll speak for about 20 minutes, and then we will go to our very distinguished panelists who will comment on how they see education and health and what some of those key challenges are that we need to address in the country. So over to you, Karthik. Thank you.
Thanks, Naushad. Thanks, CII, for putting this event together. I think this is a bit heroic because there's no way I can do this in 20 minutes, right? So what I'm going to do is just give you certain very high-level principles and then a few specific ideas. But the good news is, there is a substantial amount of engagement with senior people in government. So tomorrow, as part of this event, I'm doing a 2-hour workshop with senior officials in the education department. So these ideas have to percolate down the system. So let's start. And I think the context, this session is called Building India's Human Capital. And I think we all understand that it is a critical enabler of getting India to full potential, right? So every East Asian miracle economy that had over 8% growth built high quality mass education systems, okay? So simply put, the Indian model is working well, but we're not firing on all engines, okay? So when you have 50% of kids complete primary school in rural India without being able to read at a second grade level, when you have 35% of children who are stunted, that's just permanently compromising the long-term potential. And so we know that this has to be done. The critical question is how, okay? Now, the challenge is that the default approach by most sectoral advocates is to argue for more spending, okay? So education wallas want 6%, health wallas want 3%, everybody wants more money for their sector, okay? But there are two fundamental challenges with this view. The first is we don't have the money, okay? So fiscally, a lot of these benchmarks of 6% come from OECD benchmarks of tax to GDP ratios of 35%. We are at a tax to GDP ratio of 18%. So the parallel session there is talking about mobilizing resources, okay? So that's exactly the challenge we face. And so we're not going to just spend our way out of this problem, okay? Because if you wait till our tax to GDP ratio gets to that level, we're not going to be there. But the second problem, and this is kind of the key point that we've learned from about 20 years of research, is that a key finding from all the high-quality empirical research in the social sector is that the translation of government as usual, and in fact, my original term was business as usual, and as senior secretary in the government suggested, why don't you call it government as usual? Because that's true, that this translation of spending into outcomes is actually quite weak, okay? So the point is not that we don't need spending, we do need more spending, but it is absolutely critical to improve the quality of expenditure, which is the translation of the spending into the outcomes, okay? And so the core point, which, why I wrote this book is that over a 20-year period of working on education, on health, on welfare, on child development, what you see is most of our discourse is at a sectoral level, but the real binding constraints are cross-cutting constraints of governance, okay? And it's really the effectiveness of public systems that we need to focus on before you can actually deliver better. And it's not just about saying sectorally, I'm going to design a new program or create a new scheme. This is going to require kind of really re-engineering and thinking about the functioning of the Indian state. So there have been substantial improvements, and I think the political leadership understands this, which is why in the past decade, I think the areas where you've seen massive progress have to do with DBT and kind of, the entire financial stack. But there's a long way to go in the services that are still intermediated by humans, right? So whether it's education, health, police, courts, these are all human intermediated services. And the second challenge is all of these are state government issues, okay? So you really need to think hard at the state level. So tomorrow I'll also be speaking at the panel with multiple chief secretaries on center state, the road ahead. But the big point here is that the state capacity agenda really is the binding constraint. And so the main reason for writing the book is that a common theme across 20 years of research is that the return on investment on investing in better governance and state effectiveness is often 10 times more than simply increasing the budget, okay? So a different way of saying this is that most of our public discourse focuses on the top line of budget allocation, but not the bottom line of how that budget translates to impact, okay? So if you then look at what intermediates that, it's really the effectiveness of public systems, okay? And so that's why the book is really, it's two halves, okay? And the first half is kind of what it will take to build a more effective Indian state, okay? And at some level, these principles, all of you are from the private sector. This is not rocket science, okay? This is basic management 101, that effective organizations are able to use data for better decision making. They have better personnel management. They allocate their money in high ROI activities. They have a viable revenue model. And if you're a global MNC, you need to optimize what you're doing at global headquarters, national headquarters, field headquarters. And the same thing applies in a federal governance structure. And similarly, if you're a company, you need to decide what are you going to make in-house and what are you going to buy externally from the market. And you face exactly those same set of issues in optimizing the functioning of the government itself. Okay, so I'm not going to have time to go through all of that, but I'm going to highlight certain key challenges. Now, the good news in the book is that the reason it's big is that the first half of every chapter outlines a set of systematic challenges, but the second half is then talking about actual implementable solutions, okay? So what I'm going to talk about today is just give you a jhalak, as they say, right? A glimpse of some of these issues, and then I invite you to dive deeper, okay? So the data, I think, again, we have good statistical systems for retrospective data collection, but we don't have them. They're not timely and granular enough to drive kind of decision making. So given improvements in technology, there's a lot we can do on that. Let me just talk about personnel for a moment, okay? So one of the things about the Indian state is what most people don't realize is we are actually one of the most understaffed public sectors in the world, okay? So we often think that we have a big bloated public sector, but relative to the population and in terms of the service delivery requirements, the employees per capita in India are about 1/10 of the Scandinavian countries. And even relative to China, it's about, it's about a third. And so the point is that we actually need a lot more frontline staff. Okay. Now the question is, why do we not have them? It's partly because Indian government employees are among the most overpaid in the world. Okay. And so there's cross-country evidence that shows that the public sector wage premium in India is so high. Now at the very top, that's not true. Okay. Because we have wage compression. But for most government jobs, the government pay is much, much higher. And this is not just a simple problem for state capacity. Okay. One of the general equilibrium points to highlight is how the structure of public sector labor markets also affects the entire economy. Okay, so one of our biggest drivers of unemployment among educated youth is kind of the craze for government jobs. Okay, so we have now studies showing that 80% of unemployed educated youth is because they're writing government exams, okay? And so it's not just about the inefficiency of how you're staffing the government, it's what you're doing to the entire economy, because the reason you're producing students who can take tests and cram exams but not have real world skills is because the most lucrative employer in the economy only cares about exams and not real skills, okay? So that's the tail that wags the dog of the entire education equilibrium, okay? So this is not just about public sector, it's about the entire labor market. Okay, so again, these are things I'm just giving you a glimpse of, but I invite you to go, read the book for all the evidence, all the facts, and how this is all put together. Okay, now a second key conceptual framework in the book, and this is one of the core ideas in the public finance chapter. Okay, so again, in the private sector, no CFO will allow you to spend even 100 crores without doing a discounted cash flow analysis and saying what is the ROI on this investment. Okay, but in government, we don't have that same kind of ability to do these ROI calculations, and we often spend money that doesn't have the highest ROI. Now, you might say, but government is not just about ROI, it's also about equity, it's also about justice. Absolutely, which is why this is a framework that we can use to kind of look at every major public finance expenditure and classify it on this 2x2 axis of equity and efficiency. And the main point I want to make is that reasonable people can disagree about policies in the second and the fourth region, okay, about whether you prioritize equity or efficiency. But what I want to highlight is there are many, many ideas that would improve both equity and efficiency that we are not doing because we are spending so much of our money in ways that are bad for both equity and efficiency, okay? So I'll give you some simple examples in the context of rural welfare, right? What the research shows is a program like NREGA is good for both equity and efficiency because it does a great job targeting the poorest, the landless, and with the work requirement. And it also creates positive demand multipliers in the economy, okay? Conversely, something like free electricity for farmers is bad for both equity and efficiency because the top 5% of landowners get 50% of the subsidies, and that also creates a whole bunch of downstream distortions, okay? So the point is to look at, given a set of objectives, can we achieve those more effectively? And the real free lunch that we have to accelerate development is to improve the quality of our expenditure, okay? So federalism, I think the main point I want to highlight is first principles of federalism would say that service delivery functions should sit with local government because it's the local parents and users who are the necessary constituency who can hold staff accountable. And it turns out, if you look at the data, that India is actually one of the most over-centralized countries in the world, okay? So even a country like China that we think of as highly centralized, over 50% of public spending in China happens at the local government level. In India, that's 3%, okay? Now again, the culprit is not center to state as much as state to local, okay? And so there's a lot more we need to do in thinking in a nuanced way about our decentralization agenda because that's going to affect the governance of service delivery. And then the last point on the state and the market is one of the consequences of weak public service delivery is kind of a mass exit to the private sector, right? So education, 50% market share in urban areas, about 30% in rural areas. Health, the estimates about 60 to 70% of primary care is sought with fee charging private providers. So the subtle point here is that the government plays three very distinct roles in service delivery, right? The government is a policymaker, a regulator, and a provider, right? Now, as a policymaker, the private sector is your ally because you want to deliver for people regardless of who does the delivery. As a regulator, the public and private have to be equal. As a provider, the private is your competition, okay, because you're competing for the same market share. Now, the problem is because 95% of government budgets and personnel are allocated to government as provider, it instinctively often distrusts the private sector, okay? So there is a lot more you can do by kind of thinking, you know, a typical health secretary or education secretary still thinks of their job as running the public health system, okay? But your job is to improve health for the whole country, and often you can do much more by paying attention to making markets work better, okay? So we've got some amazing research that shows how better just disclosure, right, of quality in markets can improve outcomes in both public and private, okay? So there's a lot of evidence-based ideas, but that requires us to have a mindset that we are about making markets work better. And you can also leverage private providers for the poor. But both of these functions also require state capacity, okay? So there is no silver bullet, which is why there's a set of principles here and then a menu of ideas, okay, that we can try. Now, while the problems are difficult, I also want to kind of highlight some very important reasons for optimism, okay? Now, the second half of the book is called Accelerating India's Development, right? And the goal is in picking these 6 sectors of education. So one of the great debates in development is kind of the growth versus development debate, or the Bhagavati Sen debate, right? So should we focus more on growth or should we focus more on human development? By picking these 6 sectors, the beauty is you don't have to choose, okay? Because each of them are important for human development, but each of them is also important for growth, okay? So better education is intrinsically good and it's going to contribute to growth, okay? Now, the point is, how can we be optimistic and accelerate development? And the picture I want to show you is this is one of the great triumphs of development in the second half of the 20th century, okay? And what this is called, it's called shifting of the Preston curve, where the x-axis is GDP per capita, the y-axis is life expectancy, and those two curves are at different points in time, okay? So the lower one is 1930, the upper one is 1960, and by 2015, that has shifted up even further, okay? So what that's telling you is that over time, poor countries are able to deliver much better development outcomes, even at the same level of income, okay? So poverty even at a given level of income, you can deliver much more over time, okay? And the question is how, and the key answer is new technologies, right? Because, you have new technologies that you did not have before. So 100 years ago today, the President of the United States could not save his son from dying from a bacterial infection because there was no antibiotics, okay? So today, that's a routine issue. So the deeper point I want to make is that most acceleration of human progress has come from the creation of new knowledge, from the transmission of that knowledge, and acting on that knowledge, okay? And health is a sector where we have done that quite systematically. But the question is, can you do this for development more broadly, okay? And the key way to ask this question is, what do today's low and middle income countries have that today's high income countries did not have, okay, when they were rich? And the key thing that we have in the last 20 years is much better data and evidence, okay, on the quality of expenditure. So the explosion of microdata, computing power, experimental methods, and this is what was recognized by the Nobel Prize in Economics in 2019, has just dramatically increased the evidence base we have to improve the quality of expenditure. And what that research shows is that many very, very expensive policies and programs have little to no impact, but many very inexpensive ideas are not being scaled, partly because we think we don't have the money, okay? Now, and I want to highlight again the importance of research, okay? As an economist, I don't worry about how private sector companies produce, because you face market prices for inputs and market prices for outputs. If you're not competitive, you'll go out of business, okay? But in the government, you can spend taxpayer money badly for a really long time, okay? So you need to discipline this with evidence. And let me just give you one simple example, okay, of the power of this data. So here's a picture that I consider to be perhaps the most important picture for understanding education in India. And this comes from a large-scale long-term study using computer-aided learning. And it's about 6,000 kids in Rajasthan, okay? And so what this picture is showing on the x-axis is the grade in which the student is enrolled, and the y-axis is the learning level. And if the children are making progress as per the grade standards, they would be on the 45-degree blue line, okay? In practice, the true learning level is about half of that, okay? So the average 8th standard student is at about a 4th standard level of understanding of mathematics, okay? But what is even more important is now with dynamic computer-based learning, I can pinpoint where every child in the sample is, okay? So every dot there is about 10 kids, okay? Now what you see if you look at that 8th standard segment is that in the same class, I have children at a 2nd class level, at a 3rd, at a 4th, at a 5th, all the way up to 8th standard. And why do you have that variation? That is the result of our well-intentioned no detention policy, right? Where we have pushed kids through to higher grades, wanting to keep them in school so that they don't drop out. But the reason you're not able to convert your spending into outcomes is because even a motivated teacher is completing the textbook and the curriculum, and that is so far above where the students are that that's not translating. ஸோ இப்போ இதே லெக்சருக்கு நடுவில் நான் ஒரு வேறு பாஷாவில் பேச ஆரம்பித்தா நீங்கள் நான் எவ்வளோ மோட்டிவேட்டடாக இருந்தாலும் சரி, எவ்வளோ குவாலிஃபைடாக இருந்தாலும் சரி, சின்சியராக கற்றுக் கொடுக்குறேன். ஆனால் எவ்வளோ பேருக்கு புரியறது கொஞ்சம் கை தூக்குங்க பார்க்கலாம். 2, 3, 4, 5 பேருக்கு புரியறது. ஆனால் நான் இப்போ ஏன் பண்ணிட்டுருக்கேன், என்ன பண்ணிட்டுருக்கேன், ஏன்னா எல்லாருக்கும் கொஞ்சம் புரியட்டும் நம்மளுக்கு தினம் ஸ்கூல்ஸில் குழந்தைகளுக்கு எப்படி ஃபீலிங் ஆகுதுன்னு. So what have I just done to you? Okay, I have given you 30 seconds in the shoes of a typical kid in a typical classroom in lakhs of schools around the country. And at that point, it doesn't matter how educated I am, how qualified I am, how motivated I am. I might as well be teaching you in a different language because you're teaching at a different level, okay? Now, the point is that it's because we have the data that we're able to have this kind of insight. Without the data and the research, we would spend money, we would kind of have budgets for programs, build more schools, hire more teachers, and then we'll break our heads as to why is this not translating into impact. And that's because you were not alleviating the binding constraint to the learning, which is that the kids were falling behind really quickly. Okay, so that's just an example. And on the optimistic note, what I want to say is, see, India is doing well, okay? So this is not, so basically if you look at the data, my overall grade of India, like a good professor, is we're a solid B+, okay? Which is, we are average and above average relative to income. But what is it going to take to get to A or A+? So like any good professor, my grade is can do better, okay? So how do you do better? And part of the whole book is a menu of ideas of how you can do better and accelerate this Preston curve, okay? So And the main point here is that if you go on the current track, extrapolating over the last 20 years, okay, and growing at 6% GDP, you'll still end up at about 25% stunting in 2047. Now, even if you grow at 8%, that number only falls to 22%, okay? But if you can double the effectiveness of spending, then even at 6%, you accelerate that to 17. And that gives you tailwinds that accelerates development because you now have better human development, and that's more likely to get you to 13%. So same in education, which is we have it in our power to kind of get to universal literacy and numeracy in the next 10 years. And why do I focus most of my attention on 0 to 10? It's because the future of these children is yet to be written, okay? So the actions we take now, is what matters. Whereas politically, there's often more pressure for youth employment because 18-year-olds vote and children don't vote, okay? But by the time you're 18, it's often too late, okay? So you really want to be starting early and starting with the best data and evidence that you have, okay? So I'm going to be out of time, but what I'm going to do is just put out like 2 or 3 simple ideas, okay, which are kind of evidence-backed. So in schooling, for example, we had this well-intentioned policy of creating a government school in every habitation. Now, this may have improved access, but it's hurt education quality in many, many ways, okay? So it's resulted in lakhs of subscale schools. We have over 4 lakh schools that have less than 50 students and 1 lakh tiny schools, okay, with less than 20 students. And that hurts pedagogy, governance, social integration, and cost effectiveness. It's bad for pedagogy because you have multi-grade teaching of 1 teacher teaching 5 grades. It's bad for governance because these schools are far away without enough oversight. It's bad for social integration because your communities in rural India are mostly segmented by caste and community. So you don't even get the social integration that you should get with public schooling. And it's also really kind of ineffective cost-wise. So consolidating schools to a minimum size of 150 or 500 can sharply improve school quality. You get better pedagogy, better governance, better social integration, and more cost effectiveness. And it's critical, of course, to provide transport. And what you see is parents are more than willing to send their kids to private schools. They take the buses and go 3-5 kilometers. So there's no reason why they would not do this, okay? Now, of course, the political problem is that nobody wants to shut schools, okay? So my simple idea is instead of closing your existing small-scale SSA schools, you could use that to upgrade the Anganwadis, which are often operating in really ramshackle facilities. So then you rebrand these as upgraded preschools, and then you move the whole system of quality up the chain instead of having this challenge of how do I optimize and also have to shut schools. So that's kind of one idea. There's a whole bunch of ideas. I'm out of time. So let me just talk about one more and just say, this is one of these really, really low-hanging fruit, okay? So early childhood development, among the most important stages. So India's policy commitments have been expressed over the last 20 years across governments in several landmark documents, okay? We had an 86th constitutional amendment to do this. It's in the RTE. But the school learning outcomes are still, low, and quality of ECE is weak. So the challenge has never been policy intention. The challenge has been state capacity to implement. So what we did, and the ICDS is the world's largest kind of preschool program that's going to cater to almost 80 million children. We're coming up to 50 years of ICDS, so it's a good moment to reflect and seeing how can we strengthen this and make this better. So as part of this, we worked with the government of Tamil Nadu to do a series of evaluations of different approaches, right? The whole point is you have a limited budget. How are you going to spend this money, okay? So we looked at hiring an extra ECE facilitator. We looked at unconditional pay increases. We looked at supplemental nutrition. Long story short, this is evaluated again with a large-scale randomized control trial published in one of the top journals, and we find that the extra worker was by far the most effective intervention. So having this extra worker focused on preschool education gave you large gains in student learning, substantial reduction in malnutrition, stunting, and underweight because you were freeing up the time of the existing worker to do more work in health. And most importantly, combining kind of economics and social welfare, we estimate, based on global estimates of the long-term returns to these gains, that the return on investment is about 1,200 to 2,000% because it's at 12 to 20 times the cost, okay? Whereas we get no impact of the unconditional pay increase, but that's where most of the money goes, okay? And so again, it reflects the politics of the fact that the existing workers have a stronger voice, and therefore most of the money goes into unconditional salary increases. But if you're able to hire more and keep them local, you're going to get much, much bigger impacts. Now, of course, you can't scale this up overnight, and I think in any ways, this is a lower bound on the effect because the social and economic returns of hiring this extra worker will include female labor force participation, participation, and there's a whole range of other reasons to think this is a great idea. Now, of course, this was Tamil Nadu where things work well. I have no guarantee this is going to work in other parts of the country. So what I would recommend is kind of a gradual phased out scale up, where we test and constantly iterate. But this would be like one of the highest priority things I would do, if you wanted to have cost-effective evidence-based ideas for how you would do this. And health, we're going to turn over. I'm just going to put the cover and not talk about it, which is we spend over 90%, 94% of our health budgets on curative private health, whereas again, all the evidence shows that investing in preventive public health is going to have you a much, much higher ROI. Okay, so even here we have models like Tamil Nadu has, is the one state that has a really high quality public health cadre. Okay, so if you look at the best performing health states, Kerala and Himachal deliver good health at high cost, whereas Tamil Nadu delivers similar health at a much lower cost. And most expert studies attribute this to the public health cadre. Okay, so GOI has recommended this, but take-up has been low, so I think we can do a lot more. So again, sorry for rushing. This is just like I said, a glimpse. There's a lot more in the book, so happy to engage over time. Thank you.
Thank you very much, Karthik. The bit that I was going to tease him about earlier was I said, look, do not try to summarize 600 pages in 20 minutes. And he did that very well, actually. So anyway, so our first panelist actually is Nandini Rangasamy. Nandini is the chairperson of the GRJ group in Coimbatore, and she runs several schools. So Nandini, you bring a very direct personal experience to the running of schools and schools quality.
Good afternoon, ladies and gentlemen, and distinguished guests on the dais. So this afternoon brings us together to discuss a vision for the future of our nation, a vision that capitalizes on the incredible potential of our young population, as we very popularly call it our demographic dividend. So we stand at our country stands at a pivotal moment, and I'm sure this demographic dividend can be transformed into a formidable force for economic growth and innovation. And central to this transformation is the imperative to build our human capital through a robust focus on education. So as we explore the priorities of school education in India, we aim to shape a skilled, innovative and resilient workforce that is equipped for the challenges of the future. Just a few priorities, key priorities for the Indian school education I'd like to place before you. The first and foremost, I think Karthik has already explained to us about the quality of education in the country today. So this means investing in effective teaching and learning. We need to train our educators to adopt learner-centric methodologies that foster critical thinking, problem solving and creativity. Our curriculum must align with the demands of the 21st century, emphasizing on STEM, digital literacy and socio-economic learning, which is extremely important for the current generation. And moreover, we must ensure that our schools are equipped with the necessary infrastructure and resources, well-equipped classrooms, libraries, laboratories, and access to technology for every student in the country. Inclusivity is paramount. We must provide equal access to quality education for all the students in our country, including those with special needs. There is a divide between students studying in the private sector and the public sector. So this is where I'm saying quality education should be accessible to all students. And we should also shift our assessment and evaluation methods to competency-based assessments that truly measure skills, learning outcomes, and creativity. It is there in many curriculums, especially the national curriculums, but it's not there in some of the state board curriculums. Additionally, incorporating social and emotional intelligence, as we discussed before, into our education will prepare the students for leadership and teamwork in their future endeavors. Next focus should be on skilling and job creation as early as in school education. This involves embedding vocational training into our education system, providing practical job-oriented trainings in many sectors that are out there now, collaborating with industries through apprenticeships like is available in Europe and Australia will bridge skill gaps and provide hands-on learning experiences for our students right from grade 8 onwards. We must foster entrepreneurial thinking by offering education that encourages mentorship and access to resources, ideation for our students in the school level itself. Next would be in this digital age, technology in education is non-negotiable. We need to ensure universal access to digital tools and reliable internet, especially in rural areas. Leveraging AI and EdTech can help us identify learning gaps and provide personalized interventions for each and every student. Collaborating with private entities through public-private partnerships will enable us to build and scale effective digital learning platforms too. Focus is also needed on strengthening early childhood education. Implementing the NEP 2020 effectively will provide universal access to quality pre-primary education. Making foundational literacy and numeracy a national priority ensures that all children attain these skills by grade 3. Lastly, to gauge our progress, I think Karthik's projection showed a lower learning curve for our students in India. So we need to gauge the progress of these students. We must benchmark India's performance in education against international standards. We have very ambitious targets by year 2030, but yet achievable. We are looking at a top 50 rank in the program for international student assessment for reading, math, and science, a place in the top 20 of the trends in international mathematics and science study rankings, and a top 50 rank in the progress in international reading literacy study. So I leave it to you all to ponder over these issues that are existing in our school education system. And as we visualize the future of the education sector in this country, we need to think hard on how we are going to have all these aspects looked into, and all the policy changes that are required at multiple levels need to be put in place. I also recommend a minimum of 6% of our GDP for education. Tailoring programs to address barriers for girls and marginalized groups is also extremely crucial, and one example is expanding the midday meal schemes to support adolescent girls. So we must develop digital platforms to ensure continuity of education and promote reading, writing, and communication in both regional and global languages to enhance employability and global adaptability. So in conclusion, by achieving these decadal priorities, India has the potential to lead the global economy by transforming our education system into a model of inclusivity, innovation, and excellence. I end with a quote by our Honorable Prime Minister, Shri Narendra Modi: "Reform, perform, and transform is the need of the hour." Thank you.
Thank you, Nandini. Our next panelist is Dr. Shuchin Bajaj. He's the founder director of Ujjwala Cygnus Healthcare, and I think he's going to talk about prevention in healthcare, which ties in directly with Karthik's point earlier on.
Thank you very much. Good afternoon, everyone. It is an honor for me today to address you as we discuss the critical topic of human development, human capital development here. I've attended a couple of other sessions as well, and as we gather here to speak about economy and the rising markets, artificial intelligence, machine learning, GDP, trillions and billions of dollars, unfortunately, a vast majority seems to slip below all safety nets that we are trying to create for them. And in India, we're speaking about more than 300 million people who do not have access to high quality healthcare, especially in situations where the golden hour and emergency is of critical importance. This divide, this unequal facilities that we have in our country is an unfortunate reality for us. And it is not just in healthcare, it is in all sectors. On the one hand, we are sending, moon launchers and Mars rovers, but on the other hand, we struggle to provide good quality public transport to our communities. On the one hand, we have gated condominiums, but on the other, we have slums sprawling out as far as the eye can see. And healthcare is no different. On the one hand, we have the highest quality hospitals and healthcare providers, the best doctors the world can offer. But on the other hand, we struggle to provide even basic primary preventive care to most communities. This divide is not just unjust, it is quite unsustainable. At our healthcare group, Ujala Cygnus, we've always strived to provide the highest quality, most affordable healthcare to communities that do not have access. And this work has taught me one vital truth. Human capital is the most valuable asset a country can have. And it must be nurtured through strong investments in healthcare as well as education. Primary and preventive healthcare is the bedrock of this, right? Because the costs of curative healthcare are prohibitive. And as Karthik said, we cannot really afford costs at the level of the OECD countries that everyone aims to ask for, right? As he said, health walas will always seek 3%, the education walas will always seek 6%. But where do we have the money to offer that? And unfortunately, we do not estimate the cost of the disease correctly as well. We are just looking at the direct cost of the disease in most surveys. So India, as we all know, is the diabetes capital of the world. We have 100 million diabetics almost in the country. And we know 30% of them will end up into kidney failure. We are amputating one foot almost every 5 minutes due to diabetes complications. So if a poor person develops kidney failure, develops gangrene of the foot and comes to us, we can maybe congratulate ourselves and pat ourselves on our back that, oh, we'll treat you for free because we are champions of Ayushman Bharat. The government has given this wonderful scheme which we are championing as well. If you had gone to the big city hospital, you would have spent 2-3 lakh rupees on this. But is this really the cost of the disease? The cost of the disease is much higher. Because now he doesn't have a leg, because he is in dialysis twice a week, he cannot really go back to the factory or the fields that he was working in. So his future earnings that are lost run into lakhs and lakhs of rupees. But the scariest cost is the intangible cost of the disease. Because he is now out of a job, he will pull his children out of school and start sending them to work. So many future generations will be destroyed because we could not detect the diabetes in time, because we could not prevent the complications, we could not control the diabetes in time. So primary and preventive healthcare, I think, is the bedrock of all human capital development that we are trying to work on. A sick economy cannot be a fast growing economy. If we are aiming for a $5 trillion economy, we have to make sure that the communities that we are working with are healthy, are having good healthcare seeking behavior, are aware of what their health issues are, and go and access healthcare at the right time, not too late. Going to a curative tertiary care hospital, even if it's free of cost at the point of delivery, is ultimately too costly for us as a community, as a nation. We must rely very strongly on technology to drive this. I agree that technology may sound further from us right now in healthcare than in most other sectors, but I think we are at a cusp of technological revolution. If we can carry preventive healthcare to the villages, it's not too far when we can carry it inside their homes. Getting wearable devices, making sure we are following their health in real time, detecting diseases in time, and making sure that we can prevent the complications early on will go a long way in saving costs for us. This can only be done through partnerships. Alone we can do very little, but as partners, government policies can set the stage, but the ingenuity and eligibility of the private sector to go fast and go quick, and the grassroots needs of the civil society organizations, the penetration that they have. I think if all of us come together, then we will be able to do much more than we can do alone just in the government or just in the private sector. Finally, we must make healthcare a movement, not just a service. Health is not just the absence of disease, it is the foundation of productivity, creativity, and growth. By ensuring equitable access to healthcare, we will not just save lives, we will create a workforce that will build the India of tomorrow. I want to leave you with a vision where a child in a remote village has the same chance at life as a child in a metropolitan city. An India where healthcare and education are not privileges but rights. And an India where our human capital, 1.4 billion of us, is the driving force behind our success as a developed nation. This is not just a vision, it is a responsibility that all of us have to carry out together. Thank you very much.
Thank you, Shuchin. I think we all share your wish. Our next speaker is Dr. Randeep Guleria. Randeep is the chair of internal medicine at Medanta, but I think we all actually know you, Randeep, as a very safe pair of hands all through the pandemic when you were the director of AIIMS. And I think all of us really received great reassurance of how things were actually being handled and what we needed to do from a health perspective at a very critical time. So thank you for all of that.
Thank you for your kind words, sir, and good afternoon, ladies and gentlemen. To begin with, I would really echo what Suchin said in terms of the health sector and the need to focus on preventive health. And the reason why I feel this is more important is because there is a paradigm shift as far as health is concerned in our country. From an era where we were having a huge burden of disease which was basically because of communicable diseases, India has shifted significantly, and the burden of disease is now more towards non-communicable diseases. We have had outbreaks and pandemics, but if you look at the data that is there, the burden of disease now is more towards chronic diseases, cancers, heart diseases, diabetes, chronic respiratory diseases, chronic kidney diseases, whereas maybe 20, 30 years ago we were fighting malaria, tuberculosis, infant mortality was high, mother and child diseases were much higher. So as the paradigm shift has happened in the burden of disease, these are diseases where preventive health becomes even more important, because chronic illnesses that now are happening are illnesses for life. So you could treat malaria and the patient could go by, but if you have a person with hypertension or diabetes, he needs treatment throughout his life, and you need to worry about end organ damage, which can actually impair the quality of life. So I think it's very important for us to understand that as health has changed, our needs change as far as the health system is concerned. Also, although we have a huge population, the need of the population is also very high. We need an additional 3 million beds. We need additional 4 million healthcare workers as far as the WHO data is concerned. And we need to understand that this distribution continues to be uneven. We have a lot of or a high density of healthcare workers, doctors in tier 1 cities, but as we go to smaller and smaller towns, there is actually an absence of healthcare workers, and that's why you have a lot of people who are not properly trained actually managing healthcare in villages in rural India. So that is a stark reality which we need to understand. How does the system work in India? I think let's first look at that quickly before I give what I think we could do. We have the government-funded system and we have the private system. The government-funded system looks after the vulnerable population, the lower socioeconomic status, and it's supposed to also look at various other programs, whether it be the vaccination program, whether it be screening, or whether it be various other programs in terms of surveillance. The system is grossly underfunded and has poor infrastructure as far as one can see over the last 2 or 3 decades. And that's because healthcare, like I said, not only it has changed in terms of the burden of disease, it's changed dramatically in terms of how healthcare is perceived. So let's say 30 years ago when I was, let's say, a resident, health was something where investment was not that much. You just needed to have a hospital, you had beds. You just needed an X-ray, you didn't have things like ultrasound, CT, MRI, or PET scan. ICU just had a simple monitor, you didn't have high-class monitoring. But all that changed in the last 2 or 3 decades when technology moved rapidly into healthcare. You started having better diagnostic facilities, you started having better ways of monitoring people, but that also came with the cost, and therefore the cost of healthcare became much more, both in terms of investigation and in terms of providing health facilities in terms of hospitals. That actually changed the whole paradigm in terms of investment, because we moved from an era of clinical medicine to an era of investigative medicine. You would go to a doctor in the past and he would examine you in detail and give you a prescription and you would start your treatment. Today you would go to a doctor and he would give you a list of investigations that you need to get done first before he starts you on treatment. And that is why I think we need to understand that there has to be more and more investment in healthcare because of this paradigm shift which has happened. And that has led to the government sector not being properly funded, decreased infrastructure, and obviously not proper accountability and optimal use of the facilities in the government sector. A lot of frustration has occurred in doctors and healthcare workers in this area, and that's why there is as was mentioned also, there's a mass exit of doctors from the public sector towards the private sector. The other side of the story is the for-profit private sector. That has done well, that has started booming. We have a whole issue of medical tourism doing very well in our country. But this has led to increasing out-of-pocket expenditure. And as Suchi mentioned, a large number of people actually, it's not only the individual who has to pay for it, the family has to pay for it when it comes to the expenditure as far as healthcare is concerned. And therefore, I think this is something that we need to understand and address and see how can we find a solution if we want to have a vibrant India which is healthy and where the quality of life is provided to every citizen irrespective of where he is staying or what is his socioeconomic status. And I think there are a few things that one needs to look at. We have a good private sector, but it has its flaws. We have a public sector which is not functioning that well. There is a need to see how we can develop a good public-private partnership where you can look at how can we also use this partnership for training allied workers, training other staff so that they can enter the system as far as healthcare is concerned and be able to provide at least some degree of health to even rural India, which is of good quality. We need to see how can we optimize spending in terms of optimal use of our resources with accountability. How can we look at the whole paradigm shift that we may have in terms of better use of our resources, combining what is available in the public sector and what is available in the private sector. And I think India is one country where we need to look at frugal innovation. How can we innovate in a way that we can make healthcare more cost effective? We use a term in North India which says you do a jugaad, that you do something that you try and find a way out by. So we need to look at various jugaads that we can do as far as the health system is concerned which can make it cost effective. Because the cost of healthcare currently is really very, very high. And I do feel that when we look at the health system, because of change that is happening, technology coming in, more and more ways of being able to monitor patients better, more and more ways of being able to reach out to patients because of tele-education and telehealth, there is a need for us to really adopt and adapt to the changing technology which is coming in. And that needs to be built into the medical curriculum itself. So there is also a need to look at how we can improve our medical education with changing times. And at the end, I think there is a need for us to develop partnerships between policymakers, public sector functioning, private sector functionings, and of course patients who are the consumers. Everything that you do has to be patient-centric. If we are able to really involve them, then I think there is something that we can do. And I do agree that there is a need to look at a public health cadre for the whole country. It's something that is really needed. And ultimately, what is needed is, as was said by the government, that we need to help a policy that we can say to the world that we can heal in India and we can heal by India. Thank you very much.
Thank you, Randeep. Our last panelist is Sri Anil Malik. He's the Secretary of the Ministry of Women and Child Development.
Thank you so much. Good afternoon, ladies and gentlemen. So I am going to talk about this topic, what my ministry is doing about, developing human potential, human resources of the country. There is a presentation, if I can move it. Yeah. So we basically are running 3 big missions, mission mode programs in our ministry, about 15 odd schemes. We deal with basically children up to 6 years of age and expecting ladies and young mothers and adolescent girls also. So the idea is that since conception, when the child is conceived and then when he's born, up to 6 years when the mental development is more or less done, brain is developed by that time, the health of the child as well as the lady who is expecting or who delivers, that is maintained. So, we have a healthy generation. So, these are just figures. We are everywhere in the country, about 1.4 million Anganwadis spread across the country. And these are the objectives of the mission, like development of human capital. Nutrition is one topic that we deal with big time. And many of us think, we know nutrition. We eat food 4, 5, 6 times a day. But I'm not sure any of us really, or many of us really know, what is the meaning of real good nutrition for the body, or we maintain that kind of nutrition. We just have to learn from, the good top athletes in the world, what they eat, how they eat, and what they don't eat. So, and then you realize, there are so many bad things that we do with our liver and body every day. So, we deal with this issue big time, and our schemes are barrier-free, entry-free. Anybody can come, any beneficiary can join. There is a legal obligation also that, we have to provide the difference between the recommended dietary allowance and also the average daily allowance that is available to many, relatively lower income groups. We also deal with the early childhood care and education. I think we were talking about it, so I'll just put some, words about that also. This is the basic nutrition program through take-home ration as well as hot cooked meal that is provided in the Anganwadis, and take-home rations, dry rations are provided to the beneficiaries. We have revised the nutritional standards last year, made them more comprehensive, and we are also going to look into the quality of the rations and the food big time. There is a lot of institutional change that is happening. Not moving. Okay. As I said, we have several schemes for the expecting lady or the young mother. These are the schemes listed out. Health Ministry is also there. So multiple schemes. There are no entry barriers and cash transfers happen. This Matru Vandana Yojana, more than 2,000 crores has been transferred to about 4 crore ladies till now. So it's some money. For adolescent girls, we have nutrition as well as health education and skilling also. We are now entering into the skilling arrangement with the MSDE, and about 2 million adolescent girls across the country in about 220 odd districts we have. So we are going to train them also in non-traditional occupations so that they become more empowered and they can take their own decisions later on. I think you spoke about this. You said Anganwadi, the infrastructure is not good. Yes, infrastructure in many Anganwadi is not good, but we are going to upgrade them, over a period of time and make them really, good centers of nutrition and early childhood education. So we are investing big amount of money. Right now, about 200,000 Anganwadis are going to be upgraded, and then in next few years, we are going to take the rest of them. So all these things will be added. They'll, be practically at par with good schools. This is the early childhood education program that we are running. This is the 2 basic documents we have, Aadhaar Shila and now Chetna. We have uploaded them on our online system. Actually, we don't do anything on papers. You will not believe, but we actually are doing it. All our Anganwadis are digitally linked across the country to the states and to us. We are digitally linked with them, real-time basis, every day, day after day. So all these things are uploaded on the online platforms. We are training the Anganwadi workers in this joyful play-based learning, so that the child is ready for the school after he clears the Anganwadi part by the time he is 6. This is what I was talking about, the tracker. We have a big IT system where it's a big technical aid for the worker. She has a smartphone, and it is available in local languages. She can communicate, we can communicate to her and get things done. She uploads data of the Anganwadi every day on the tracker, where instead of any survey or any episodical random survey, etc., our survey happens every day. There is a dynamic identification of the nourishment indicators, and as per the WHO standards, auto calculation of the nutritional status of the child and the lady that happens. And of course, it's a good one for the decision makers. This is a comparison like pre-tracker and post-tracker. Obviously, all IT systems have huge advantages. So all those advantages are available. Now there is, auto-generated reports and all those things. The files and the records are out. They are maintained automatically in the system. Auto scheduler is there, like Anganwadi worker has to visit some homes, the home of a expecting lady, or there is a malnourished child in the Anganwadi. She visits the home for special, talk with the family, or other, visits with the ASHA worker, A&M. So all these things happen now as per the schedule charted through the digital system. So, these are the advantages of the system. It has really made our life very simple, and our decision making also very simple, and has made monitoring and supervising almost 1.5 million Anganwadis rather easy now, and it can be done sitting in offices from distances. I think we need to look at these indicators. The first 5 are the NFHS indicators about children 0 to 6 years. Some of them are 0 to 4, 0 to 5 years also. There is progress, no doubt, since last about 32 years. There is no doubt there is progress where the numbers have actually increased. Now we have about 90 million children with us. So this is the data, the last 2 lines of the tracker. But couple of things we need to really look at: why stunting is not coming down the way it should, and why there is so much difference between the figures of wasted percentage as given in the NFHS 5 and our figures. So we need to really look at that. We are doing that. This is our mission for the ladies, where the helplines and the stop centers and all these schemes are there. They are relatively new schemes. Helplines are also relatively new. So now it's like, in times to come, we may have like something like 911. Practically we have those 2-3 helplines. They are all integrated with each other. The help can come very easy now, 20-30 minutes maximum. The average time is about 20 minutes. You need police resources, ambulance or whatever to the woman or to the child. Okay, various schemes. I would like to just highlight the Sakhi Niwas, the working women's hostel. This year, Government of India has committed 5,000 crores for constructing hostels across the country, about 1,000 of them. And we are also going to catalyze a lot of private sector investment. I'll just go back, I think this one, yeah. This is for the children. Obviously, we don't see those children except as beggars, etc. There are a lot of children who need our protection. So state is there, state is looking after them. Children who need care and protection. Sometimes children also get involved in legal issues. So we are running this scheme also across the country. About 200,000 children we are looking after right now. I'll just tell you about the last one. So This is for 5 years. Our budget is, I mean, it's not that the funds are a big issue. It's just that the quality of use of funds, the proper project management, that is an issue that we need to fix. You can see now the states and the center, they are spending 213,000 across 5 years. It's more than 42,000 crores per year. It's a lot of money. So this is what I wanted to present, that for human development of children and young mothers and young girls, this much money we are putting in different schemes of nutrition, health, and we think that the children born today, they'll be leading India into 2047 when the Honorable Prime Minister has given a clarion call that we have to develop this country by that time. So we are very sure that the challenges that we have right now in terms of malnutrition, etc., we are going to overcome, and we'll have very good health and nutritional indicators. I thank the Finance Ministry and the CII for this opportunity, and you also, you guys, for patient hearing. Thank you so much.
Thank you. Thank you very much, Mr. Malik. Thank you. We have a short amount of time for questions, so I'm going to skip my questions and come straight to the audience. What I'm going to just a second. What I'm going to do is to just take 3 questions and then come back to the panel. And I'll take all 3 together. One ground rule: it needs to be a question, not a comment. If you have a comment, we'll have the discussion after the session outside. So question, please. And second, if you can keep it very brief so that we can get the 3 questions and then get responses from our panel. So I'll come first in front right here, and then I'd like to go somewhere at the back, actually. So right in the corner there, the lady sitting the back who had her hand up, and we'll go to the back there if that's okay. Yeah, thank you. Okay, go ahead. Yeah.
Good afternoon, everyone. Thank you for the insightful session. I think young people like us are the human capitals. So we are very proud of that, first and foremost, and thank you for the insightful session. My question is, if we can summarize in 30 seconds, what is the first thing we can do to improve the human capital? Means, what is the lowest of hanging fruits we have to improve that? I think that would be the better start.
That's a nice question for all our panelists. Thank you. Yeah, go to the back there.
Good evening. Thank you so much for giving me an opportunity to ask the question. My question goes to Nandini Madam. This is regarding the early child care and early education. She talked about the importance of AI, importance of critical thinking, importance of everything. Other than that, I feel that moral education in today's time, I feel that we should give impetus on moral education from the very early childhood education, which was there earlier, but I don't know in the current...
Your question is?
The importance of moral education. Are we integrating?
Moral education. Okay.
Yeah.
Thank you. Okay, back there.
There was no mention
sorry, it was actually the other gentleman behind you at the back. No? Okay, go ahead, please. Yeah.
There was no mention of artificial intelligence in solving India's health and education problem. What we heard a lot, artificial intelligence will bring major revolution in health and in education also. Any reason for skipping that subject? Thank you.
Okay. So what I'm going to do is I'm going to use my privilege as the speaker to give Ashank a question, because he had a question, and he's a good friend, and otherwise he'll give me lots of grief.
Yeah. You should better allow me to ask questions.
Yeah.
So on a serious side, thanks for analysis, practical wisdom from people in field and government's fields, which I also didn't know many of them. My question is, to you maybe, but to everyone, is you talked about saying that it is not about as much as spending money, but about efficiency of delivery and so on. Can we look this another dimension to it? It is not about total spend in education and total spend in health, but the proportion that is spent between primary, secondary, and health, tertiary, or primary health, secondary health, and tertiary health, primary education, secondary, and higher education. So, do we have any data on the proportion that is being spent country-wise? You gave a lot of data on China and others, which is interesting. Do we have a proportion? So, my hypothesis is it's not about total spend, but proportion.
Okay, proportions for spending on health. Health, particular health and education.
Primary versus tertiary, primary versus tertiary.
Education. We'll maybe focus on education, Karthik, and I'll come to you last for that. Yeah. So let me start with the first question, and for that I'm going to request a very quick answer from any of our panelists, even all of our panelists, that if you can do only one thing to enhance human capital that you feel is the lowest hanging fruit, what would that one thing be? Okay, so anyone who wishes to go first. You'll take the second question, Nandini. Thank you. Yeah. Would you like to go first? Would you like? Just speak. I think just speak.
Okay, like for me, it is like we have about 100 million beneficiaries coming to our institutions, especially Anganwadis. I wish about 40-50 million more who are out of it. They know that there is an Anganwadi and the services, but somehow, you know, they, because of various reasons, don't visit, don't come, and a lot of damage happens, you know, about health and nutrition. I wish, you know, we are able to attract them and, you know, bring them in our food. So this is very simple, doable thing, no extra funds really, you know, just a little more effort, maybe more awareness, maybe, you know, something else, maybe more IEC. So I wish that happens.
Thank you, Mr. Malik. That's a great wish. Thank you.
Since you had
Sachin?
asked for it
Yeah.
in 30 seconds, I'll give it to you
Yeah.
very quickly. I feel primary and preventive healthcare, as I talked about, I'll supplement it with an example. A colleague of mine who I travel with a lot, he takes me to all the hospitals, you know, we drive together. So he tells me that when he was young, till 6th standard, he used to come first in mathematics and races. These were the two things that he used to really excel at in school. And suddenly his father died. And then his mother said that now somebody has to start earning. So she pulled him out of school and now he's driving a car and doing odd jobs and everything. So luckily my father survived, right? He used to make kites for a living in his early days. He survived and he forced me at peril of death to study, right? If he had died early, I may not be sitting here and I may be making kites right now. So human capital, it's very important for you to stay healthy. If you're alive only, then will you contribute anything to the economy, right?
Randy? Yeah.
So I think I'd agree with that, preventive health, but I think also affordable health. The challenge that we have in our country is that there is a huge diversity. How can we bridge that gap in terms of being able to provide affordable health to everyone so that it's of good quality and no one is sort of left behind?
Karthik, if you can do yours at the end
at the end,
when I come to question 4, yeah, from Asha. So Nandini, would you
Yes,
like to take the second question?
The
then?
answer to the lady who asked me the question on
On
the
moral
primary
teaching, yeah,
and
yeah.
yes, primary education. I didn't talk about technology intervention in primary education. What I meant was the NEP clearly gives us a lot of insights into how the quality of pre-primary education can be very foundational and like how the children can have literacy and numeracy being taught at that level. So what I meant by technology is at the higher classes where of course technology is come to stay whether we like it or not. So harnessing technology for the other classes, the higher classes, using digital tools and especially leveraging the edtech and artificial intelligence is very important. That's what I meant.
Okay. There was a question on the role of AI on health and education. I think that's a whole session, if not conference. So, Randeep, would you like to have a quick
So I think
shot?
I do agree AI is going to play a big role in terms of how medicine is going to be practiced in the future and in terms of whether it be radiology, pathology, or even dermatology or various other branches. It's already coming in, but that doesn't take the need for physicians away from the day-to-day practice. So balance between the science and art of medicine is, I think, equally important.
Thank you. We did a session in our company where we got 2 doctors to speak to us who had a lot of experience. And they talked about the importance of combining clinical and investigative. And that it's not one or the other, but both that leads to good medicinal outcomes. So, yeah, thank you. Karthik, last word for you. And if you can address both the one thing and the point on the proportions, or in whichever order you'd like.
Yeah, I think, see, the most important overarching point I want to make is the centrality of cost effectiveness in how we think about these sectors, right? Because I think in the social sector, there's often the sense that the people in finance are bean counters and don't want to spend, okay? But the thing is, in a world of constrained resources, cost effectiveness is a moral imperative, okay? It's not just something that the finance and account people have to think about. So in a world, in a room, if you put 20 people, you'll get 20 different ideas, okay? So the question is, what do you do? And in practice, what happens in a lot of policy documents is you have subcommittees and everybody puts their recommendations, and then we list everything, and then we'll give a little bit of money to everything, okay? Because you want to show that you've done a bit of everything, but you're not actually delivering on the most cost-effective things, okay? So I think there's an overarching principle here about putting cost effectiveness at the core of how we think about prioritization, and that relates to, I think, a variety of things. So if you were to say one thing, so today, based on the evidence, I would say I don't think it's enough to say focus on preventive or focus on EC. I think we need details. The details really matter, okay? So, for example, government of Indonesia passed a constitutional amendment to spend 20% of their budget on education, but then all of that money went into unconditional increases in teacher salaries, okay? And we found that that had zero impact, okay? So it's not just about sectoral spending. The details really matter, okay? So right now, I would say based on the evidence, the thing I would be most confident about wanting to pilot seriously to expand is the second worker in the Anganwadis, so that you have somebody focused on early childhood education, so that somebody else can focus on the nutrition, the maternal visits, the counseling, and the evidence suggests that the returns are very, very big. Now, I don't think we have enough evidence to scale it nationwide, but a phased approach saying identify the most challenged areas, like where we have the biggest challenges, at least start there, and then start by doing some evaluations. I think that's what I would do. I think on AI, my simple point, I mean, there obviously wasn't time to cover everything, but if you notice one of the things I mentioned in that slide about shifting the Preston curve, it is about kind of creation of new knowledge, correct? So that AI is part of that process by which we create new knowledge. But I think it's also important to understand that if you look at Nobel Prize winner Angus Deaton's work, right, what he shows is that the issue is not the innovation. The issue is really building the public systems to get the benefit of the innovation to those who can't afford to pay. So the market will do innovation at the right tail of the income distribution, because all the innovation happens where there is purchasing power, and then you need governments and public systems to take that to scale, which is why most of what I focused on was how do you build more effective public systems, because that's what it takes to solve these problems at scale.
Thank you, Karthik. We're right out of time, so we'll need to end the session here. I just wanted to end with one comment, which is, it's the answer to the question of how do you eat an elephant? Right? And the answer to the question is one spoonful at a time. And it's and building India's human capital for the long term is that kind of challenge. It's a huge challenge, but we need to start with a granular approach. And I think the point that you made just now, Karthik, first of that granular approach being instructed by good research, being clear what the potential good outcomes are, and then not assuming that those outcomes will work wonderfully everywhere on the basis of what we've studied, but to iterate and try something out, and on the basis of the actual experience, expand it, and if the actual experience continues to be really good, expand it even more. And so words like wisdom, words like experimentation, words like using research as a basis for policy and going ahead on a granular delivery with a focus on both good design and good delivery built into the design as a way of approaching these elephant-sized problems. So thank you all very much for being here. Thank you to our wonderful panel. And let's continue the conversation.
Thank you. And may I request Dr. Forbes to present a token of appreciation to the speakers, please.
you very much.
And may I request Ms. Soma Banerjee, Deputy Director General, CII, to present the appreciation token to Dr. Forbes. Would request the speakers once to step forward for a photo op. Thank you very much, ladies and gentlemen. With this, we are closing this session.